break this thing. I'm Dennette Janus, and I'm a licensed therapist that works with crisis preparation and recovery, which we lovingly call CPR. I've been with the program for a little over 2 years. I was lucky enough to be the original behavioral health specialist hired into the program. And when Tom McSherry said, hey, are you interested in maybe the new fire program? It's safe to say I had no idea what I was getting into, but it's been a phenomenal experience. I'm a licensed professional counselor. I've been in the human services field for about 20 years, worked in all kinds of different arenas, and this is by far the most exciting program I've ever been a part of because it's such an impactful program and such a great idea. We do the same behavioral health assessment that people in crisis would get in the emergency room, on scene, wherever they're at, whatever address we respond to. And sometimes we have to go to different addresses to find them. But I've been in the Mountain Vista ER, I've been in St. Luke's ER, I've been in a lot of the Valley emergency rooms, going and seeing people who there wasn't another choice but to take them to the emergency room. And sometimes they've been there 6 hours, sometimes they've been there a day. And we do our assessment, make a recommendation. For those people that are fortunate enough that they had a crisis, but they really are safe to go home, which is a fair amount of the people that are brought in, they sat there for a day to wait to be discharged home with a safety plan and follow-up. So we found that that's a huge benefit of seeing people on scene. Sorry. That a good percentage of people don't have to go to the ER at all. They're assessed, they're given resources, a safety plan's put in place, and they stay home, which is it's a win-win for every part of the system. We have licensed therapists that go with the crews 7 days a week, and we assess the person on scene the same as they would receive in the ER, and make a disposition on scene. And then we have the hot ride of the group. So then we make arrangements, we make calls to the facilities, find out where there's availability at an appropriate facility for the patient's needs, and we transport them in our vehicle directly from scene to that facility. And we've called ahead and made those arrangements and made sure that it was clear to bring the patient to that facility. So our goal is to see people where they are, find out what they need with a thorough, efficient assessment, and then assess what really needs to happen and make it happen right there on scene without going to the ER at all unless there's truly a medical need for them to go to the ER. So again, I feel so lucky at this point to be a part of something like this, and to see how it's evolved from the day when we just kind of showed up and started responding to calls. So it's been phenomenal, and I'm really proud to be a part of it. I'm really honored to know all the other people that are a part of the program, and it's pretty overwhelming to be in the presence of this kind of group of people who are working to really make a difference in how things are done.